As early as 7 o'clock, Annette Nabulia shuts her home for a day in another of dozens of attempts at dental health care services. But this time, it's not a health facility. She has had enough of those, she says.
Amannyo gano gantawanya okuva mu 95 negannuma byomusawo namufuna bulungi twogera bulungi naye munnanga kabeeyi kaali kangi.
According to a 2022 report by the Uganda Dental Association, about 90% of Ugandans need dental care services in communities like Natete, where Nabulia lives. With the current national dentist-to-patient ratio at one dentist per 146,000 people, many are left at the mercy of private players whose charges are exorbitant.
Ntambudde nagende wandegeya nentuuka waliwo kiriniki omwami sijja mwogerako bubi bambi naye akabeeyi kangoba yannamulira ssente nga nange sizirina yannamulire akakadde kamu mu emitwalo 2 kati okwoza obwoza amannyo yaŋŋamba emitwalo 3.
The national healthcare system dictates a dentistry at every district hospital. Just like other healthcare needs, dental services in public health units are hindered by budgetary constraints.
The first challenge is the number of dentists in the country. It is still very small compared to maybe other professions, the general doctors, but we are serving the same population. It is intense equipment to start a dental clinic. Then the supplies are all imported. We don't have dental supplies manufactured here, so that makes the cost even higher for care.
According to the National Oral Health Policy 2007, the Ministry of Health operates on a low budgetary allocation of approximately 9% of the GDP, which is not adequate for services at low-level facilities.
The budget, I must say from the start that it's small, very small. Here at the Ministry of Health, the budget is less than 1%. The prioritization of oral health, even at hospital, is very small. It still comes to the budget. This budget that buys medicine for the general hospital is where the oral health department taps into to have its own medicine. So when they do the priority list, you see that the dental filling material is down there below at the bottom.
Dental health access challenges in Uganda also stretch further from availability to limited knowledge or resources to maintain good oral health, especially for low-resource settings. Experts have advised that a government holistic approach, which entails resource allocation, community engagement, and sensitization, is what is needed to change the situation. Nicholas Kalinge is leading other dentists through a volunteer umbrella called Max Dental to take oral care services to informal settlements in Kampala.
What we do, we go to the community and we give oral health education because we want to influence their behaviors towards good oral health. So the idea is we want to catch disease at an early stage when it is still cheaper to treat and before it advances to a later stage, which usually results into complications and also that would require very expensive procedures to manage.
The umbrella is creating a one-stop oral solutions center for low-income communities, which includes a consultation center, clinic, and community engagements. It is at this outreach that Nabulia is joining dozens of other community members to give oral one more try.
We kind of carry the entire clinic with our equipment into the community. Our community outreaches are mainly targeting low to middle income communities. Yeah, because we believe that these are people who have the problem but most of the time they can't afford. So we want to go to them and try to, to provide this service so that, everyone, those who can afford and those who can't afford, should be able to have good oral health.
Mobilization for the outreach is done in structured communities like schools, mosques, and churches where people can be treated with privacy.
Ekisooka byonna twalanga mu kanisa abantu abajja ku Sunday ne okusaba ne tufuna omuzindaalo ne gugenda nga guyita mu bantu okwongera okubajjukiza era n'okubakubiriza okubeerawo ku lunaku luno olw'obujjanjabi bwaffe obw'amannyo.
Rachel Namiyanja serves as a dentist at the camp. She notes that patients get a 3-in-1 service.
During the mobile clinics, the most preferable dental issues, especially in our communities like this, are the dental caries, dental cavities. People have cavities that they don't know how do they come. We are here mainly to emphasize mass sensitization, dental sensitization. We want to teach people, want to screen them and treat them.
Communities look forward to these dental camp days with great expectations. Those who have been served describe it as a life-changing experience.
Zenaze ninamu ebituli bwe bagiraganye nyeera naye bankozeeko bulungi bagoozezza kati mpulira akamwa konna kali smooth.
Mbadde mukyafu mu kamwa era ng'oluvannyuma lw'okumbulira obukyafu buva ku ki nakyo ekibuleeta amannyo galongooseddwa kati ne bantegeeza biki bye nnina okukozesa biki bye sirina kukozesa okusobola okulaba nti obukyafu obwo siddamu kulabika kuba nti mbeera nabwo.
The umbrella has covered over 18,000 patients since 2018 in about 10 slum communities. 4 years down the road, the percentage of tooth extractions at our clinics have reduced from 49 to 13%. And for us, we're very proud of that because people now are aware that there are other alternative treatments from tooth extractions. People also know that it's important to do routine dental checkups. However, there is still a gap in the lack of multi-sector collaboration in increasing oral health access to the ghetto. The responsibility shouldn't lie entirely on dental care providers. I think we need to have what I would call a multi-sector collaboration.
The partnership I'm talking about now we are trying to build, to strengthen, so that these people in the private sector can visit our hospitals and realize the need. If there is a way we can work together, because some of them can stock a lot of materials and their consumption will not be as much as the one in the public. So this is a partnership we are growing. As the camp closes, Nabulia is happy to return home with a bright smile. An expectation which was far-fetched by morning.
Bwenzize bandazekkeya bannazizza amannyo ne bagakuuta bulungi nnyo kale ne mpulira nga akamwa kateredde n'emmere sikyayagala kati kulya.